Hi everybody. Today I want to talk about dental radiography. How do we do it and why is it important? The how is pretty simple. Take the dental x-ray unit, position the sensor in the dog's mouth, press the button, and on the screen will come up the image. As far as why is it important, there's cases that you can't see the pathology without the x-ray, and we had one of these this week. This is where we started with this case, and you can see the very heavy tartar buildup on those back teeth. We removed that tartar, and we got to this point, and you can see the upper molars with the arrows here. Those two have to go. That's pretty obvious, but the lower one, it doesn't look that bad on our initial exam. This is a radiograph of that lower molar, and the front root is solid in the bone, healthy as can be, but the back root has a tremendous amount of bone destruction around the root. There's no way to remove half a tooth, and there's no way to save this tooth, so it's got to come out. In order to get this tooth out, we have to cut it in half and then take the roots out individually. And so you can see the cut through the crown of the tooth, and then we have to remove some bones surrounding the root that is still solid. And the small arrows depict the bone that we've removed to try to make it a little bit easier to get this thing out. Here's our post-extraction radiograph, and this is showing us two important things. The first is that both roots have been completely removed, and the second one is that the jaw has not broken. So a successful extraction, and we're ready to close this up. And here's a picture of how it looks after everything's all closed up. In a week or two, this is going to be healed, and this dog is going to feel much, much better. Okay, so this is the little tooth right there. This is just one of these cases where you never know what you're going to get into until you get in there, poke around, and take some x-rays. This dog is going to benefit tremendously from getting this bad tooth out, and it wouldn't have been possible without dental x-rays.